Welcome to the Inova Shoulder Replacement Program presentation. Thank you for taking the time to view this presentation. Studies have shown that the more prepared you are for surgery, the better your postoperative course will be. These slides were prepared to address key points about your upcoming shoulder replacement procedure. Make sure to write down any questions you have while viewing the slideshow so they can be addressed prior to your surgery. It is important that you read the patient education materials you've received, as well as watch this slideshow. These materials include information on preparing for your surgery, what to expect during your hospital stay, medication that may be prescribed to you, and preparing for your discharge and recovery. Please take the quiz also located on the Inova Shoulder Replacement website. The first thing we will talk about is your coach. Once you decide to have your surgery, it is important that you designate someone to help you, from your pre-op activities all the way through your recovery. The coach does not have to be a single person. It can be a team of people that support you. They will help you with your exercises and help you after you return home from the hospital. We expect them to learn your physical therapy exercises so they can assist you at home. They should also be available to take you to appointments and help you with your household chores. Coaches can be anyone in your life who can dedicate their time to help you after surgery, including a spouse, daughter, son, best friend, or neighbor. We would like your coach to attend at least one of your physical therapy sessions. If possible, it's great to have the coaches available for every therapy session, but we also understand that your coach may have other commitments. You may be required to see additional doctors prior to your surgery. Your surgeon will probably ask you to visit your primary care doctor. If you see specialists regularly, you may need to be cleared by those physicians as well. You may need to have additional lab work or tests before you are cleared for surgery. The final decision for surgical clearance is between your primary care physician and your surgeon. Then, your doctor's office will also ask that you talk with a pre-surgical nurse at your Inova hospital. The pre-surgical nurse will gather all your necessary information and place it in your chart for review by your surgeon and anesthesiologist. They will ask you what medication you're currently taking. Your nurse will also tell you what medication you should not be taking before your surgery. Most surgeons require you to discontinue use of vitamins, herbal supplements, and aspirin 1 to 2 weeks before surgery. These medications can cause bleeding during the surgery. If you have any concerns about which medication you should stop, please call your surgeon's office. To prepare for your surgery, we recommend that anyone over the age of 65 have a pneumonia vaccine. In addition, between the months of October and March, patients should get an influenza vaccine. These are normal vaccinations that most people should have. Please get these vaccines at least 2 weeks before your surgery. Your healthcare team will be responsible for your care needs from the start of your hospitalization through your discharge. With shoulder replacement, your team may include an orthopedic surgeon, an anesthesiologist or nurse anesthetist, physician assistant, patient care navigator, pre-surgical nurses, OR and PACU nurses, bedside nurses, clinical technicians, and therapists, as well as others. They can help you answer questions, coordinate your hospital care, and assess your needs at home, including caregiver availability. They will assist you in getting answers to insurance questions and act as your liaison through the shoulder replacement experience. Before your surgery, you should quit smoking, and do not smoke during your recovery. Smoking slows your body's ability to heal and slows bone healing. Your body needs protein, vitamins, and minerals to heal. It is important that you eat a healthy, well-balanced diet before your surgery and during your recovery. You have the right to make decisions about your care. If you already have an advance directive or living will, please bring a copy of these documents with you to the hospital. It is important to prepare for your recovery before you go to the hospital. You should go grocery shopping and think about transportation to and from the hospital. These are a list of things you should bring to the hospital. You may or may not have a copay. If you do, it is important for you to bring it with you on the day of the surgery. Your insurance company can provide you with this information before your admission. A loose button-up shirt is the best for exercising after surgery, and it will also make it easier for the doctors and nursing staff to change your dressing. Make sure to bring the necessary identification and insurance cards with you. The pre-surgical nurse will tell you when you need to stop eating and drinking before your surgery. There are some items that you should not bring to the hospital. Please do not bring your own medication to the hospital, unless otherwise directed by your surgeon or healthcare team. We will deliver all the medication that you take here at the hospital. In addition, do not bring jewelry, money, or valuables to the hospital. You'll feel much better knowing that these items are safe at home. It is possible to bring in and use your cell phone and laptop during your hospital stay. In order to prevent infection, studies showed that patients who bathe with soap containing chlorhexidine gluconate before their surgery are less likely to develop an infection after surgery. You will need to purchase this soap if it is not given to you by your doctor's office. Cleanse your whole body with this soap before surgery. Avoid using this soap on your face, hair, and genital areas. On the morning of surgery, scrub the area where you will have your incision very well with this cleanser. It is important that you use freshly laundered clothing and sheets after bathing with this soap. Before, during, and after your surgery, you will be given IV antibiotics to prevent infection. On the day of your surgery, you will check in. For more information about the location of check-in and parking at your Inova hospital, visit the Inova Shoulder Replacement Program website. Do not eat or drink anything after midnight, except medications as instructed. You should wear clean, comfortable, loose-fitting clothes. Please remove any jewelry, including body piercings, and do not use any perfume, hair care products, body lotions, or makeup. Please check in at the hospital 2 hours before surgery. Even if you are scheduled for surgery at 7:30 in the morning, it is important that you arrive at the registration desk by 5:30. In the preoperative area, you will change into a gown, you will have an IV started, and your information will be confirmed. You may have a catheter in your arm to support administration of IV fluids or pain medication. You will see your surgeon and anesthesiologist, and during this time, your coach can stay with you. This is the best time to have someone to talk to and help you be less anxious. During your surgery, your family can wait in the designated waiting area where there is free Wi-Fi. You will have the opportunity to discuss options for anesthesia before coming in for surgery. There are 2 types commonly used. General is when you're given medicine that makes you sleep and breathe with the use of a breathing tube. Regional anesthesia, also called a nerve block, acts to block sensation to the site of your operation. Additional medication will be given to you as well that will make you sleep. Regardless of the type of anesthesia, you will not be able to feel the surgery. In the recovery room, you will be connected to equipment to help the staff monitor your condition and provide pain relief. X-rays may be taken of your new shoulder, and your coach will be in the waiting room at this time. Your surgeon will find your coach and update them on your condition. Because anesthesia can make you sick to your stomach, we will start you with a liquid diet before having you eat solid foods. The type of anesthesia you have will determine how you feel after you wake up from surgery. Depending on the type of anesthesia, you may be numb in your injured arm. You may not be able to move your hands or fingers. Some patients have felt a sense of dead weight in their shoulder. These are normal occurrences and nothing to be alarmed about. The anesthesia will wear off and your arm will slowly return to normal sensation. After spending some time in the recovery room, you will be moved to your room on the recovery floor. This is where you will see your coach again and meet the members of your healthcare team who will be caring for you. You will get out of bed a few hours after surgery. Studies have shown that the sooner you get out of bed moving, the quicker you will recover after your surgery. Our number one goal is to keep you safe. We will be with you every step of the way after your surgery to make sure you are safe. We ask for you to call a staff member anytime you would like to get up and move. Due to anesthesia and pain medication you have received, you have a risk of falling. This may require a staff member to be in the restroom with you. Because you have had surgery, you are also at a greater risk of developing pneumonia. In order to prevent pneumonia, you will be expected to use a tool called an incentive spirometer. You will use this 10 times an hour while you are awake. This device will be provided to you after your surgery, and the nurses will show you how to use it. After your surgery, you're not moving as much as you normally would, and you are taking pain medication. Both of these things contribute to constipation. It is important that you drink plenty of fluids and eat lots of fiber. You will also start a stool softener in the hospital, which you should continue taking at home as long as you are taking narcotic pain medication. Your pain control is very important to us. We will ask you regularly about your pain. We will ask you to set a comfort function goal as we manage your pain. The comfort function goal is the level of pain that can exist without interfering with your function and quality of life. We will want you to rate your pain from a range of 0 to 10. 0 being no pain and 10 being the worst pain you have ever experienced. We will use several methods to keep you comfortable. We will apply ice to reduce swelling, repositioning, medication, and possibly alternative therapies. You are welcome to bring an iPod or MP3 player to listen to your own music to help you relax and recover. Medication can be given to you in various ways. You may be given pills for oral medication, injections through your IV, or your doctor may prescribe a PCA for you, which is also known as pain control analgesia. You are in charge of this medication, and when you are in pain, you push a button that delivers medication through your IV. The pain medication given to you after surgery may cause several side effects. It's important to let your nurse know if you are experiencing any of these problems, which could include drowsiness, itching, and nausea. Usually there is a medication that can be given to you to help control these issues. There is no reason for you to be sick to your stomach or to be itchy. You must stay ahead of your pain. It is much easier to take pain medication before the pain gets bad rather than waiting for the pain to get severe. If taken ahead of time, your pain can be better managed throughout the day. If you wait until the pain is bad, it usually takes much more time and medication to get you feeling more comfortable. If you start to have worsening pain, call your nurse early so that he or she may give you pain medication before it is very painful. Please remember to ask for pain medication before physical therapy if you have not had any recently. Because you are having surgery and may not be moving as much as you are used to, you are at a greater risk for developing blood clots. Several things will be done to keep you as safe as possible from getting blood clots. We encourage you to walk often and to pump your ankles while you are in bed. We may have you put on stockings to encourage blood flow and prevent blood clots. Some patients may be given medication in the hospital and after you go home that thins the blood just enough to keep you from getting a blood clot. If you do, you will learn more about all these medications before you go home. The dedicated rehabilitation team at Inova has a wealth of experience in helping people like you recover from shoulder replacement surgery. Although we treat many people, we recognize each person as individuals. We tailor your rehabilitation program to meet your specific needs. Your first therapy session will be in the afternoon of your surgery or the next morning. You may see both a physical therapist and an occupational therapist. The therapist will ask you many questions about your regular scheduled activity in your home environment. Please share your goals for therapy with us so that we can help you to achieve them. We recommend your coach participate in this session to support your transition home. During your stay, your healthcare team, including your doctor, nurse, and therapist, will help you minimize the amount of pain you feel. They will also make sure that you have a smooth transition to home. Early movement is essential to good recovery. The therapist will help you maintain any special precautions ordered by your physician. In addition, they will help you learn how to dress, bathe, use the toilet, or other activities of daily living while maintaining any special shoulder precautions after surgery. For a minimum of 2 to 4 weeks after your surgery, use your sling at all times, even when you're sleeping. Exceptions may include during therapy exercises, hygiene, or when sitting. Ask your surgeon what specific precautions he or she recommends for your new shoulder. Also, ask when you can resume normal activities including driving, playing sports, and returning to work. You should plan not to drive for 2 to 4 weeks, depending on your recovery. Bandage your wound to prevent clothing irritation. Do not soak the wound for 2 weeks. Make sure to keep the incision clean and dry until it is thoroughly sealed. For the first 2 weeks of your initial recovery, you should not lift or rotate your injured arm, including lifting any objects. Patients who've had shoulder replacement surgery should not begin an exercise program until at least 7 to 10 days after surgery. Strength and flexibility exercises do not start until your outpatient therapy visits. Please avoid any excessive stretching or reaching behind your back to protect your shoulder while it heals. Do not support your body weight on the hand of your involved side. While lying down, place a small pillow or towel roll behind your elbow to avoid shoulder hyperextension or stretching. There are several things you can do now to make your recovery period as easy as possible. First, scan your home environment or wherever you will be staying after the surgery. Pick out potential concerns and make sure to discuss these concerns with your therapist. We can help you come up with solutions and alternatives. Also, plan now which car you will use on your trip home. Your healthcare team will work together to prepare you for discharge. Our goal is to get you home to continue your recovery. You will likely be discharged from the hospital as soon as the first day after your surgery, depending on your recovery. If home care is needed, the case manager will be involved in discharge planning. Home care may include visits from a physical therapist, occupational therapist, or nurse, depending on your surgeon's orders and your insurance coverage. Discharge options for shoulder replacement include discharge home with outpatient therapy or discharge home with home therapy. You should check with your insurance company to assess the benefits for coverage of equipment and rehabilitation services, which may include physical therapy, occupational therapy, or nursing. The goal of the surgery is for patients to have a normal shoulder with full range of motion and no pain. Our overall goal is to give you excellent care and assist you with a safe, successful procedure and recovery. Our goal is to meet your expectations, and if we are not, please let us know. Thank you for taking the time to view this slideshow. Please take the quiz also located on the Inova Shoulder Replacement website. For specific guidance on your Inova Hospital's processes for your surgery, as well as points of contact, consult the reference guide on this website or your surgeon's office.